Hello everyone, I'm Dr. Richard Ferguson, the Chief Medical Officer for Health Choice Utah, and I'd like to take a few minutes to remind you of why receiving your annual mammogram is so important. 1. Let's first understand how common breast cancer is. About 1 in 8 U.S. women, or 13%, will develop invasive breast cancer over the course of their lifetimes. So that likely means you know someone or are related to someone that has been affected by invasive breast cancer. About 40,000 women in the U.S. are actually expected to die in 2022 from breast cancer. However, the overall death rate from breast cancer has decreased by 1% per year from 2013 to 2018. This decrease is a result of advances in treatment and earlier detection from technology such as mammography. And due to innovations in research, surgical options, and clinical trials, many women are now able to live longer and healthier lives as breast cancer survivors. But once again, without early detection, many of these options will not be available to you. Now, if you are performing a self-breast exam and you find a lump, what should you do? As a physician, I would not immediately worry or panic. Most lumps are not breast cancer and can often be a more benign finding such as fibrocystic breast disease. Some lumps go away on their own, and in many younger women, lumps are often related to menstrual periods and go away by the end of the cycle. However, if you find a lump, change in skin coloration, or abnormal breast discharge, please go see your primary care provider to receive an exam. Let's take that step to make sure it's not cancer. Now, when should you get screened for breast cancer? Some of that depends on risk factors and age, but generally, once you are 40, and in accordance with national guidelines, you should receive a screening mammography annually. Most physicians will stop screening at 74 years of age. Some screening may occur prior to 50, but usually if there's a strong family history. It is important to understand that 85% of breast cancers happen to women with no family history. So early detection is key, as it is still not clear to scientists as to what is the underlying cause for most breast cancers. What are some of the risk factors for breast cancers? Well, high-density breasts, age, alcohol usage, and a personal history of cancer. Some of these we can control, such as with healthier diets and exercise and reducing alcohol intake, but others we cannot. What can you do to get screened for breast cancer? For starters, you can call your PCP for an appointment and ask to have your annual mammogram. You can also schedule your mammogram yourself through an imaging center through a self-referral. Please schedule through our health links below. Make sure you bring someone with you to your appointment. Receiving a mammogram can be a bit distracting and anxiety-provoking. Having an advocate with you can go a long way to make this process that much easier. Your health is your wealth, and early detection is key to fighting breast cancer. Thank you.